Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Obesity classes 1 through 3, each category explained. Photo composite by Amelia Manley for Verywell Health. Getty Images/r/n/r/n. Overweight and obesity means weighing more than what is thought to be healthy for a person of that height. Body mass index, BMI, which estimates your level of body fat based on your height and weight, is often used to determine if a person has overweight or obesity. /r/n/r/n. A BMI of 30 to 34.9 is considered obesity class 1, 35 to 39.9 is obesity class 2, and over 40 is obesity class 3. /r/n/r/n. Having obesity is considered a risk factor for a number of health conditions, such as heart disease and type 2 diabetes. The risk for health conditions goes up on a continuum as BMI goes up. /r/n/r/n. On an individual basis, BMI may be used as a screening tool but cannot be used to determine the health of that individual. A healthcare provider needs to perform appropriate health assessments to evaluate an individual person's health and risks. /r/n/r/n. BMI is calculated differently for children than adults. The growth of children aged 2 to 19 years is monitored using additional factors, such as outlined on the growth charts by the Centers for Disease Control and Prevention, CDC. /r/n/r/n. This article will discuss the obesity classes, health risks associated with obesity, influencing factors beyond BMI, and treatment to go down an obesity class. /r/n/r/n. BMI exists on a continuum, but for clinical and research purposes, BMI measures are divided into categories indicating underweight, healthy weight, overweight, and obesity. Obesity is further divided into the following 3 classes, /r/n/r/n. Some clinicians and researchers further divide class 3 into 2 more categories, /r/n/r/n. Obesity classes do not assess an individual's health but look at overall risks generally associated with those ranges. As a general trend, as BMI increases, so does the likelihood of health problems. These classes may also be used for purposes such as population research and as part of eligibility criteria for treatments such as bariatric surgery. /r/n/r/n. Compared to people within the BMI category labeled as healthy, people with obesity have an increased risk of developing health conditions such as /r/n/r/n. Obesity is one risk factor for these conditions. The more risk factors a person has, the more likely the person is to develop the health problem. /r/n/r/n. For example, your risk of developing heart disease increases if you have obesity and other risk factors such as /r/n/r/n is calculated by dividing weight in kilograms, kg, by the square of height in meters, m. /r/n/r/n consulting a BMI index chart or using a BMI calculating tool can make this easier. /r/n/r/n. The CDC offers a BMI calculator for people 20 years old and older and a BMI calculator for people aged 2 through 19. /r/n/r/n. BMI has limitations for its accuracy as a tool to determine a healthy weight. For example, /r/n/r/n. Other tools may also be used to estimate the potential risk for health conditions. These may include /r/n/r/n. Many factors influence both the development of obesity and the risk of developing health conditions associated with obesity. These may include /r/n/r/n. Achieving the weight or BMI that is optimal for you and involves fostering an overall health-promoting lifestyle. /r/n/r/n. Keep a journal of what you eat and drink, your activities, your sleep patterns, emotions, and stressors, to help you identify where you can start making adjustments. Look for things in your lifestyle that could pose challenges for your weight loss. /r/n/r/n talk to a healthcare provider about connecting with support and resources, such as a registered dietitian or community programs. /r/n/r/n start with a goal of losing 5% to 10% of your current weight. While this may seem small, it can significantly reduce the risk of developing obesity-related health conditions. /r/n/r/n aim for gradual, steady weight loss of about 1 to 2 pounds per week. This increases the chances of keeping the weight off compared to those who lose weight quickly. /r/n/r/n make long-term goals, such as losing a certain amount of weight, and short-term goals, such as taking a walk, or adding a serving of vegetables to your meal. Focus on 2 or 3 goals at a time. /r/n/r/n ensure goals are, /r/n/r/n gather around people who will support you in your health goals, including friends, family members, coworkers, and others with similar goals. /r/n/r/n evaluate your progress in terms of your goals, and make adjustments as needed. Reward your successes with non-food rewards to help keep you motivated. /r/n/r/n focus on adopting healthful eating practices that you can stick to long-term, rather than short-term dieting. Talk to your healthcare provider about the amount of calories to take in to make sure you are meeting your body's needs while you lose weight. Your healthcare provider may refer you to a nutrition or weight loss specialist, or a weight loss program. /r/n/r/n being physically active burns calories and has health benefits such as strengthening bones and muscles, reducing the risk of disease, such as heart disease and diabetes, improving brain health, and improving your ability to do everyday activities. /r/n/r/n moderate intensity physical activities increase breathing and heart rate, but you can still carry on a conversation. Examples may include /r/n/r/n vigorous activities substantially increase heart rate and typically make you breathe too hard and fast to have a conversation. Examples may include /r/n/r/n look at your sleeping habits and stress levels. Making sure you get enough good quality sleep, and practicing stress management, are important steps to supporting your health goals. /r/n/r/n in some cases, particularly for those who fall under the classification of Class 3 obesity, weight loss can be difficult to achieve and maintain with lifestyle changes alone. /r/n/r/n your healthcare provider may suggest treatments such as /r/n/r/n seeking guidance from a healthcare provider specializing in weight loss can help you decide what approach is appropriate for your health. If you have a higher BMI, you may have nutrition counseling covered by your insurance. Ask your healthcare provider about seeing a registered dietitian to create a more effective personalized plan for achieving your goals. /r/n/r/n a BMI of 30 or over is considered having obesity. Obesity is divided into 3 classes, with increasing BMIs. Risk of health conditions increases as BMI goes up. Obesity can increase the risk of developing health conditions such as type 2 diabetes, heart disease, and stroke. /r/n/r/n BMI alone cannot measure a person's body composition or health status. Further evaluations performed by a qualified health professional are necessary to make this determination, which is much more complex than a BMI value. /r/n/r/n if you have obesity, losing even 5% to 10% of your body weight can reduce the risk of obesity-related health conditions. /r/n/r/n if you feel weight loss might be beneficial to you, talk to a healthcare provider. They can help you make a plan that emphasizes healthy ways to achieve and sustain a body weight that is right for you and adopting lifestyle habits that promote health, such as nutritious eating and physical activity. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.